Hello everyone, and welcome to another edition of Health and You Community Wellness Series. Thank you so much for joining us today for this very important discussion on the benefits and risks of social media for children and teenagers. As you know, the overall objective of this series is to create community awareness about health and disease, with the ultimate objective is to enhance self-care, reduce suffering, improve the quality of life, and increase healthy longevity. A few housekeeping rules before we start. Your cameras and microphones are turned off. Use the Q&A feature or the chat feature to type your questions. Questions will be addressed at the end. And this is not a CME CPD activity, so no certificates of attendance will be issued. So today we have an expert speaker talking about a very important topic. Social media is a powerful tool. It connects, it educates, it entertains, but it also comes with its challenges and can impact young people's mental health, development, and well-being. Today, we'll explore how to navigate some of these challenges while making the most of the opportunities that social media offers. We are delighted to welcome our expert speaker, Dr. Amal Khidir. Dr. Khidir is Associate Professor of Pediatrics and Assistant Dean for Faculty Development, Vice Chair of IRB at Weill Cornell Medicine-Qatar. She is also the former Clerkship Director. Dr. Khidir is American Board Certified pediatrician and a fellow of the American Academy of Pediatrics, a member of the Council of Medical Education, Medical Students Education in Pediatrics, has co-led the Research and Scholarship Collaborative and co-chaired the annual meeting. Dr. Khidir is also a member of the Academy for Professionalism in Healthcare and co-chair for the annual meeting committee. She is the co-founder of the professionalism program at HMC, which has more than 4,000 faculty, trainees, nurses, and pharmacists participating. She's led and participated over 50 peer-reviewed regional and international professional workshop and received several teaching awards and research and CPD grants. Please welcome Dr. Amal Khidir. Dr. Khidir, over to you.
Thank you very much, Mrs. Anan, for the kind words, and welcome everyone. Assalamu alaikum. Peace be upon you. Thank you all for joining us. And I would like to have you go with me over this journey. And I'm going to address it as, first of all, as a parent, but also as a pediatrician and educator. And I hope we learn together throughout this journey. And as you know, it's not an easy, simple one. So hopefully we can get the maximum out of it. So I have no conflict of interest, and I'm not going to discuss anything commercial in our products in this conversation. My main goal today is to go over some discussion points to look at the role of social media, the role of social media on children and teenagers, their health and development, and also the benefit risk of this social media that we are all involved in. Policies and guidelines beside recommendations to parents. And I have here parents, healthcare providers, but I think also counselors, teachers, hopefully might benefit from some points from this conversation. So looking at media in general, there are two kinds of media. There is the broadcast one, which goes with TV and movies, and there are the interactive ones, which are the social media and the games. There are many benefits for them because they expose the children, adolescents, and us to new ideas and knowledge. Also, opportunities for social connection and support, beside access to health promotion messages and information. And then we know recently there is a lot of disinformation, so we have to be also careful about that. The risk is it can have negative effect on weight and sleep. As you know, and I'm quite sure during the pandemic, many people with the lockdown, they resorted to social media and other means, and that did affect some of us, their weight, and also some sleep disturbance. And we'll go over some details as we go along through this journey. Also, it get us exposed to inappropriate, inaccurate, and some unsafe information and also contact, and it compromises privacy and confidentiality. And we'll go over some of this. The media effect on children can, if it is too much, especially even if we think about only TV. I know sometimes we feel TV is a benign thing and they can stay hours and hours, especially for younger children, because it keeps them busy and so we can do other business. But too much of it or excessive exposure to TV can lead some cognitive delay because they're going to just work with the screen. There is no interactivity. It can affect the language acquisition because they're listening, they're not practicing. And also their social and emotional development will also be affected if we're not paying attention to that. And the risk increase if we started really early in their life and we keep them there for many hours, as I mentioned, and also low educational content. So TV and other means of media, it can have the colors, it can have songs that teach them letters or other social skills, that's fine. But if it does not contain something they learn from and they stay there for hours, it can be also harmful. So we talked a little bit about social media, which is one of the interactive kind of media. And I would like to go over these definitions from the dictionary. Basically, the social media is, forms of electronic communication, such as websites for social networking and microblogging, to which users create online communities. And this is very critical because as we go along, we need to know where our kids are going or adolescents to share information, ideas, personal messages, and other contents. It can be pictures, it can be videos, and others. Also, another definition, it is websites and applications that enable users to create and share content or to participate in social networking. So the common platforms, I'm sure you all know them. It's Facebook, which declined at some point and came back. We have YouTube, WhatsApp, Instagram, TikTok, X, which is the former Twitter, Messenger, Telegram, LinkedIn, Snapchat, and the list goes on and on and on. And I'm sure by the end of this talk, you will have other applications too. The question will be, these are the common platforms that children, adolescents, and us will use. But it has maybe positive influences or it can be negative influences. And that's what we want to talk about today. So we know by research, and you all also notice that it is becoming really an important part in the children, adolescent, and their parent lives, right? And it has significant effect on their health and their development and well-being. And we're going to go over a few examples in some positive and negative way. So some of the positive ways in social media, it can bring the family together. They can find recipes together. They can watch videos together. They can watch even YouTube together, depending on what they want to watch. It can be for entertainment. It can be for learning something. It can just keep them, giving them other skills. It can be related to education. It can be related to just having fun. So it can currently, as you know, even at some point during COVID, a lot of the social media was used also for education. And it also helped all of us to be connected because currently, as you know, many families are across the globe and it can be one of the easy way for all of us to connect, but also with friends. Also, it can help our learners even to do projects and collaborate together. So there are many, many positive things. We don't want today just to talk about the effect in any, only to take the message it's negative, but there is a lot we can learn and use this technology for. But there are drawbacks because in social media, if you have a child who has a phone, and we're going to talk about this, or adolescent has a phone, there's sometimes some aggression that happens. Sex-related stuff can happen from images to language to other kind of interaction, can be related also to increased drugs use, and we can talk about that. Obesity, because they are not going to leave, because what will happen is sometimes they're so hooked to internet, so hooked to the social media platforms that they don't want to go and play, don't want to go outside, and so forth, which can be also harmful and lead to like obesity. Self-imaging is related to, it can be also for the passive viewers because they will see other people picture, they see some text, and sometimes that distort their image about themselves, can lead to eating disorders, can lead to depression and suicide. It can lead to a learning disorder because they also might spend more time than finishing their homeworks. And recently, it's looking at sleep deprivation, especially when they have it in the room at night and they stay late on that, beside the stimulation and the blue light and everything. Also, problematic internet use, and we're going to talk more about it, and internet gaming disorder. And actually, these are called disorders now. So as you see, it can really be as a positive blessing, but also it can be problematic. Looking at sleep, it is known by research now that being so much involved in social media, it can lead to a significant disturbance of sleep, and it is very well documented. And it's not only on adults, but also, as you know, older children and teenagers now, many of them do have phone and tablets and the computer and others, and they're so much engaged and sucked into this that even they lose track of time. As you know, being in this interactivity late at bedtime might be something fun they want to continue, or it can be something disturbing, and they have all these emotions and they cannot impact them in on timely fashion, and they stay late. And what exacerbates this, as I mentioned, is when they have it near bedtime. So if you think about it, the phone usually charges in the bedroom beside the bed, and every time they hear a ding, they will learn to look. Also, they can be very busy trying to answer a message or getting curious, and there's a gossip going on and what have you. And that leads to poor sleeping. And if you have poor sleeping, they will have also poor academic performance because they're not awake on a school day and they are not able to function, and they're continuously tired and sleepy. Now, I just mentioned there's a problematic internet use, which is PIU. It is known as internet and video game addiction, actually. So there are three factors. Sometimes people get really obsessed and they want to always check their social media. And I think as I'm saying this, many of us might have that also. And they can neglect what they're supposed to be doing, like can be homework, can be work, can be an assignment, it can be a report, you as an adult, but also imagine those are children and adolescents. They have to finish their homework, they have to finish their projects, their assignments and others. And because they're too busy, they cannot get themselves out and stop to continue what they need to do. And lack of control. And they're really, those are the addicted ones. And basically, they cannot even control stopping it. And it can be social media related stuff or it can be gaming. The good news is it's not a big percentage of people are having this. The video game addiction also, it's also called internet gaming disorder. And it's a problem also because it is lack of control of these gaming habits. And this will affect their daily functions, like their personal, even it can be related all the way they are not even taking care of their hygiene or eating or taking care of their meals. Social, they're not interacting. They will have difficulty even to interact with other people. Definitely it can affect their education, okay? And if they have a job or a task or a project, they will be behind it. And this addiction, they're really, really calling it addiction, but the good news is not a big percentage do have this. And I'm mentioning all of this because I want to alert all of us to pay attention to all the things happening without us really thinking it might happen to our own children or the children around us. It can be our students if we are teachers. It can be our students also for counseling them. It can be our relatives and our loved ones. And it can be, and the older, the gamification happening to the older kids. But I know now there are younger kids who are also getting hooked. to this. Now, part of the solution is to limit their exposure because that will help us to improve their health. And what part of health we're talking about is sleep. And we have mentioned this more than once now, because sleep helps them to grow, help them to have their hormones even working properly, because there are some of them released at night and they need to sleep. It will affect their weight, and maybe they gain more weight, except if they go into things related to eating disorder. It affects their attention, definitely, because if they don't sleep well, their attention will be disturbed. But also being on all these images and all these kind of different activities, their attention span can be affected, and hence affect their intellectual and social development. Okay. And it may lead to high-risk behavior. And this high-risk behavior can be part of it because that's what they see in the social media. And by the way, there is a lot of selling can happen in the social media. And as you know, many people manipulate our children through social media. And we are going to talk about some of these soon. So they might abusing drugs or doing some risky kind of, like the skateboard skating or diving or doing some other stuff because they saw other people do it. And as you know, adolescents also, some of them don't have that understanding and maturity to value risk. And even the younger kids, because now even the little kids are seeing also some dangerous stuff in these devices. So I'm going to mention to you some 12 tips to help the parents in this digital age. And after I go through the list, we'll go over some of them in detail. So I'm going to share with you through the American Academy of Pediatrics. There is a page, I will give the resource later, is related to family media use plan. And you can actually go to that website. It's free. You register. You can have for every single family member one, and I will talk more about it. And you can have this family plan where it helps you how many hours to be on social media, how many activities, and so forth. So it helps people to organize their lives. Okay? And it's important that you set some boundaries. I know if you did not do it yet, when they become teenagers, it becomes a big fuss and a fight. But hopefully, you figure out a way to work with your teenagers, but also you have the younger one in the pipeline. So work with the younger one, create some screen-free times and places in your home. So there is a time we're not going to touch any device. And by the way, you have to be also a role model if you are a parent or a teacher, okay, or a caregiver. Okay, have a regular discussions among the family about online activities. Try to have this habit. So as we grew up, we used to have the meal time where the whole family gathered together and have a meal and we discuss how the day passed by, what happened, whatever. I see now it's hard to maintain that, but then we have to actively figure out a time where we can sit down and talk. It can be other life stuff, but now the online can be something really we need to pay attention to and have some conversations. And these conversations also depends on the level of their children. It can be a 5-year-old, it can be a 15-year-old, it can be any age. So you have to be careful how you can have this conversation and what you're going to talk about. And talk about social media in detail. And even in the social media, there are different platforms, as you know, and also be careful what you post, how you post it, whom you talk to, and we'll get to that. Make sure your kids know they can come to you if they feel there's something not right. You will soon realize the whole thing is interconnected. So if, as a parent, you have some interesting relationship with your loved ones, like younger or older, they might be suffering through something and they don't want to be blamed or be guilty or other. They might not come and talk to you. So we have to have these bridges all the time available and all the channels open. And they also sometimes need to really understand what is real and what is not real, because online they see, for example, other families are happy, enjoying, especially when you go to YouTube and others. There are some families portray that they're always happy, they are wealthy, they have this and that, and they are always like in a tourism status and having fun, and they come and look and see at home, we're not doing this. Why we're not doing this? We're an awkward family, we're a sad family, and what have you. So you want to help them figure out the differences, that not all what they see is 100% real, and there are exceptions, and there sometimes things are edited too. And also try to get them to understand, and this usually for the older kids, that how social media is connected with emotions. Because let's say you have a child who is sad or upset or had a difficult conversation with a friend or with you or with the teacher, others, and then he goes online and starts expressing his emotions, her emotion or his, with somebody, and they assume that somebody is somebody who's their age, and they get trapped into other issues. And you also, this is very critical, the parent, the teacher, and the counselor and people around them, and especially the parents and caregiver, have to be their role model. So we have to be careful, because many times we are not paying attention to them. The same as you're driving and texting, and then when your son or daughter is he or she driving and texting, you get mad at them, but you're doing it. So you have to be a role model too, even with social media. Okay? And optimize that time by sometimes sitting together, enjoying time, looking at stuff together, and reflect on what you see. And be careful to check the setting of the device that you handed to your loved ones. And there is a lot of parental control, and we have to learn how to use them. But also, remember, sometimes our kids are smarter than us. So once we set something, they figure out something else. Not only that, the hackers and others, the people who they are talking to our kids in this social media arena, they also can also manipulate what you do. So just be careful, and you have to frequently check that. And now you also have to be careful to analyze what you see. If you see signs of problematic media use, like if you see there's a change in the behavior of your loved ones, younger or older, if you feel they're getting quieter or they spend time in the room alone with the devices, they don't, and many times they have a password, they don't want you to know it. And other that as long as their behavior is the same, that's good. But if you see any deviation, don't take it lightly, because you don't know what else is going on. Okay. And number 12 is the key one. Think carefully before getting your child the phone. Two parts of this. I see many parents have the kids in their own phone. Like, you don't buy them a phone, but you give them your phone because they're either bored or creating commotion in the place, or you're in the clinic and you want them quiet, or you're in the mall or whatever, you give them your phone. You're giving them access under your name. So maybe you don't have settings in your phone, and they will just browse, and it's just a swipe currently. It's not like many buttons and you have to spell something. But also, we see many parents actually purchase phones and give it to their kids. And this, you have to think and think and think and think and think before you hand them over the phone. Because once they have the phone, you have to make sure they're mature enough. And even before mature enough, you had the conversation with them. You have set the limits. You have also the parental, depending on the age and if you want to do it or not. Because once it's in their hand, the internet is everywhere. Even if you lock the internet at home, they can access it at school. They can access it in the malls. They can access it in their friend's house. So basically, be very careful when you hand it to them. Okay? Now, this social media can affect, as you see in the picture, all the family. So again, building a family media plan is very critical, because you can build it for every single person in the family. And as you build this and you build your plan, as I mentioned earlier, you have to have a free zone and a free time, no screen time, okay? And you can have one kind of screen time in that plan, hopefully. I know now they're using computers, they're having some virtual meetings or tutoring. alhamdulillah, we don't have COVID, but still there's a lot of virtual academic activities are happening. So you have to weigh and balance all of that. And after you create a plan for every single person in the family, because if you have it for you, for your wife or husband, and you have it for your kids and the older and the younger, we're all equal. I mean, the plan can be modified depending on the age of the person, but then everyone has a plan. And then keep revising it because things are changing on us. Activities do change on us. Maybe we have a season of football now, but we don't have it later. So the hours will change. We have exams, we have board exams, we have final exams, we have a trip and others. So these plans can be changed, but you have to be mindful how you change it. And it's better if you plan it together, especially for the older one. So if you go to, this is the website, healthychildren.org. And if you go to the family plan, this is how it looks like. And it will ask you, do you want to update or have a new one? You click a new one, and then it asks you about some details, and you can create for every single member his or her plan. And maybe your teenager can create it with you. Okay. Now, these signs of problematic media use, remember earlier I mentioned if you see them, their behavior changing and others, because they're using social media or gaming, it might be affecting their eating habits, their bedtime, their physical activities. For younger kids, you might notice that they're becoming more, they argue in every single thing, especially when you ask them not to be on their phone or tablets on social media. And at the same time, they lack interest actually in any other activity. And I have seen kids actually so distracted that they might even remember to go to the bathroom and mom brings them because they pee on themselves. And they're older. Yani they're not 3, 4 years old, which is natural. It can be 7, 6 years old, but they're too busy. They don't have time to go to the bathroom. They don't have any medical problem, but they are very entertained and very busy taking care of this social media. For other one, you find them, they're more withdrawn from friends, and sometimes it can be related to issues with friends. Or it can be they're too busy even to have a chat and face-to-face conversation with others. Okay? And the most serious one is when they are stopping their hobbies too. Because you're not sure, is it because they're busy or they're entering into depression? Is it anhedonia or something else going on? So these are some of the soft warning signs, but you have to investigate and look in depth what is going on. So few things might be affected, and these can be the reason for it. Some of them might have some mental issues related to, there is no clear research saying the social media can cause mental health like depression, anxiety, but what they see in these social media can be the reason. It's not the hours they spend on social media. So the content of what they see might lead to some issues. As I mentioned earlier, like the eating disorders and whatever. And then we're going to talk about cyberbullying, sextortion, and sexting. About cyberbullying is basically which is electronic or online bullying. Okay. And this happens when other people are sharing some embarrassing pictures about the person. Let's say if I'm faced with someone is cyberbullying me, for example, they might share my pictures that as a friend we had it in a party or in school, or I shared the picture with them. So they share it and get me really embarrassed. They can disclose my secret or my information, and they might disclose and send mean messages to the person. Or are they ordering other people to ignore the bullied person, or asking others to leave this person out? And you know, as a teenager or even younger now, this peer pressure is really hard, and people would like to be in a group. And once they face this because someone else doing it to them, can be really hard. Okay. Or spreading rumors and the gossip, you know, they love gossip. So even spreading rumors about people, this can really, really affect the child or the teenager. If we want to compare the cyberbully with bullying, bullying usually that we're familiar with, both of them are bullying, but bullying usually happens in a space, in a place, and usually is face-to-face and in school or others. The difference here, both of them are bullying, but the difference here, in the cyberbullying, things can go viral. Like if I'm being bullied by someone in front of me, he might say or do something to me and it will just stay there. But in social media, it can go viral. Million people can see it. Okay. And when it goes out, you cannot retrieve it. It can happen anytime, anywhere. The regular bully that we're familiar with can happen in school hours, or in the gym, or in the soccer field, or in the mall, or in the parking lot. Very contained. But this cyberbully can happen anytime. Can be in the middle of the night, can be early in the morning, can be anytime. So if I'm getting bullied, I'll be on my toes all the time. Okay? And can be also anonymous. I don't know who said what about it. So that's the issue. And that really disturbs our children and adolescents. Okay? And it can cause harm because it leads to academic difficulties. Part of it, some of them don't want to go to school anymore because a couple of kids in school are doing that to them. It can be also because they cannot sleep the whole night thinking about the message went out or the picture that someone sent it to everyone, or even the secret I told X who spread it to Y and Z and A and B. And now how I can face all these people in school or other places. It can affect my physical health too, by lack of sleep, not eating, mental health too, being very anxious or maybe depressed, and some might commit suicide. So that is part of the harm of all this cyberbullying. Okay, and some of them might result to substance use. Okay, so saying that, if you get to know about it, the very important piece is to be very supportive to your loved one or the child or the adolescent. Do not threaten them. I'm going to take the phone from you or the iPad because you misused it, abused it, or you got exposed yourself, or be guilting them. You have to be very supportive. And by the way, you also need to seek support too, because it's really tough for the caregiver or the parent to get to see that their loved one is suffering and struggling. Okay? And then you have to document and gather evidence. Like if there is a screenshot or others, collect it, because at some point you might need to report it. And there are rules and regulations for this, because sometimes it can go all the way to cybercrime. And sometimes it goes all the way to people actually asking kids to suicide or push them all the way. Okay? And also, as you seek support for yourself and you support your loved one, you also look for resources and talk to your pediatrician, talk to the psychologist, the social worker, and others. You can talk to the counselor at school if it's happening in school, even all the way to the principal. So don't take it lightly. Okay? The best thing is to prevent all of this. And the best way to do this is before you give them the device or they get exposed to all these devices and social media and try to use it, even if you don't give them device, they might be using social media with others. Okay? Have the conversation and the discussion. As you know, the most important is awareness. And also, again, it depends on the age of the child or the teenager and their ability to comprehend what you're telling them. Simplify it, but make sure they understand and they are knowing that not to take things lightly, and they have to come and tell you if there's anything happening. And again, to come and tell you, that means, as I said earlier, all connected. You have to have a good relationship with them, that they don't even fear you to come and tell you. And you have to monitor. Monitor means if you have give them devices every now and then, check what is happening, check your parental control, see what's going on, okay? And always design a plan. And that's why, remember, we have the family use plan, but also depending on what's happening and what kind of social media they're involved in, trying to figure out what accounts, because then you might know of 2 accounts. And there are studies showing that many parents don't know how their kids are using social media and what accounts they have. And accounts usually say most of them 18 and above, and there is also 13 and above. They can fake their age and they can get accounts. So, mashallah, kids are very manipulative and very smart. So, yeah. Okay. Sexting basically is sending or receiving sexual explicit. It can be images, it can be videos, it can be text. And the reason I'm mentioning this, we should not assume anything because it can happen and we have to be careful. So your kid or loved one might not send anything, but because he or she in this space, they might receive something. And there is a study in the US showing that in 2021, 19% of the kids sent a text and 34 received one. And all of these sex-related texts, okay? And others might have forwarded it without consent of someone, like someone got a picture, send it to someone else, okay? And females are exposed to it more than males, and older teens are exposed to it most likely to send. So imagine a little child, 5, 6 years old, okay, well-behaved, well-raised, and you have the device in their hand and something came through. And without knowing, they watched it, or without knowing, they just sent it. So you can see how things can really get out of control, okay? And the problem is it will reach a point because it's so common. Everyone is seeing everything, and it's so prevalent that it becomes normal. And we know this clashes with morals of family and their beliefs and their religion and how they want to raise their kids. So this can be really a problem. And in some states, this sexting can be a legal issue. And some of them, it can be, even in the States, there are some laws, it can be a felony and they can be jailed. Okay? Sextortion, basically, an online predators. And in the dictionary, extort means obtained by force or blackmailing. So what happened is, the extortion is a non-physical coercion to obtain explicit images for favors or others online from the victim. And they use it, for example, many times happen this way. Someone online doing whatever, one of the kids, innocent kid or whatever, and then someone connect with them because he or she was mad and talking about this and that, and then that person assumed or communicated with the child or the teenager, and the child or teenager thought that person is the same age, and they know how to manipulate the kids and the teenagers. And then somehow they send them a picture, send me back a picture or text or whatever, they exchange something. And then after that, the predator uses a child picture, video, or text and start blackmailing the sender, who is the child or the teenager. Sometimes for money, sometimes for favor, and they keep pushing them. Okay, and usually they talk teenager and to pretend to be their age, and they pretend to be they love them or in relationship. Okay, and they can hack their devices that way and get more personalized information. Okay, and in 2022 there were 300 cases like this, and the FBI issued the National Public Safety Alert. Okay, so things do happen and slip, and we all have to be careful. The recommendation is to talk to our children and teenagers, never to send compromised images to anyone, hatta to a friend, even to a friend, because you never know if their phone is hacked, the picture is out. Not to send these pictures, whatever, hatta even if it's a regular picture, as you know now with AI and with all the Photoshop, whatever, they can take the face and put it in different body and just ruin their reputation in life. Okay, do not open any link or email that you don't know who the sender is. When we're not using the devices, the cameras and all these devices have to be off. Do not use easy passwords to any device. So teach your kids that, or your teenagers. Okay, do not accept friend requests from someone you don't know. Okay, Your role as a parent, as a counselor, as a caregiver, as a pediatrician and health provider to be supportive if this is noted, okay? And always have the doors open and have your ears and eyes open too, okay? And let them come to you and always support them that they are not alone. And then you try to figure out what is the best action to take and whom to report it to, okay? Now, I will share with you after all this heavy lifting some recommendations because I had one time a mom in the clinic and asked me, at what age shall I give him the phone? And it took me a minute to figure that out, not because I don't know the answer, it's because it's so prevalent that kids should have the phone in their hands. And I see it a lot in the clinic because the mom needs to focus with me to listen to what I'm trying to say, or for me to focus on what she's saying, and the child is fussy or upset or busy or actually demanding and mandating to get the phone. And they can be as young as 3 years old or younger. So I pulled this from this website that I'm going to share with you. It's the American Academy website, and it has a lovely material that I'm going to give you the website soon. They said if and this by studies and research, that less than 18 to 24 months, these kids, you avoid media except for video chatting, and it has to be with a caregiver beside them. So don't leave them on the phone by themselves or tablets or others. And if they are 18 to 24 or older, okay, use the pediatric family media use plan to decide the optimal balance of healthy activities versus use of digital media, okay? The assumption as we're growing, the 2 years old is running around and playing, not being on a device watching stuff like YouTube and others. They can watch songs, they can watch some educational stuff, but it has to be limited. And then when you choose something for them, it has to be high quality programs. And the best is to co-participate. So you watch it together, basically. When you have 2 to 5 years old, okay, now look at this. First bullet point, 2 to 5 years old, they're allowed 1 hour per day. I'll pause here. How many 2 to 5 years old are spending more than 1 hour a day? Okay. And also try to ensure as frequent as you can, adequate physical activity, sleep, try to figure out a way for face-to-face communication and conversations. And I know in some parts of the world, the kids are left with their nanny, for example, and the nanny is trying to clean and busy, or with the mom who is really busy trying to cook, trying to clean and others, or with other strangers, or in, I mean, the kid has to, we have to figure out a way where they can have face-to-face communication and have a conversation. As I mentioned, that improve their language and their social skills, okay? We have to have a device-free meals because when we have the devices with the meals, sometimes that affect their intake. Also, again, we talked about the high-quality program, review with them, avoid, this is very important, avoid violent and fast-paced content because the violent views, and unfortunately now the news is, most of it is really dramatic because of a lot of crisis going on. We have to be careful for exposing them early on in their age, okay? And we talked about turning off the devices when they're not used. And some people use the social media or media in general for calming the kid to sleep. That should be avoided, okay? And then all this social media related stuff and media in general has to be stopped at least 1 hour before bedtime, not during mealtime, okay? And not during parent talk and play. Parents can monitor the social media activity. We talked about participating and viewing, set limits, role model. I'm saying it again, so don't forget. Increase awareness of the risk, and that's what we try to talk about today. At all ages, we should limit their own electronic media use in the presence of children. So basically, this again taking us to be role models in front of them. Okay. Healthy relationship with the media as a family when we sit down. Try to avoid having a harsh conversation and minimize conflict about media use in our family conversation. Let's try to make it positive and encourage all the positive behaviors. Set boundaries, appropriate contact, teach ways to handle emotions and boredom. Because sometimes when they're bored, they don't know what to do, we let them sit in front of a screen. Let's figure out something better than that, okay? And also teach them about kindness, because remember, we don't want our teenagers and kids to be also mean to other people, right? Kindness in online is important, and talk to them about safety and think before you share. And this parenting, basically, when our kids are younger, we have a photo of them. It can be they're doing some mess or in the bathroom, or they're cute. Now, when you send these pictures out, it will stay there and remain there. And you don't want them to be upset at you when they are older. So just be careful about sharing your own kids or teenagers' pictures. You can have a teenager where you have a very cute picture and then you put it somewhere on Facebook, you send it to your friends, or you put it as in any of these social media platforms. Your teenager might not see it as a cute picture and you're embarrassing them and what have you. So just be careful, you as a parent or caregiver, when you're sharing pictures too. Okay? Okay. Now, the pediatrician role, basically, as a pediatrician health provider, because I don't know, maybe some of them are attending with us, okay? You have to address it at some point. We have the anticipatory guidance, which health education. We should try to work on educating ourselves. And I know this field is evolving. As I mentioned earlier, by the end of this webinar, something else is out. And we might not be keeping up. But we have to talk to the parents about the importance of the social media and how to monitor it and share resources with them at any stage of their children or adolescents, okay? And work with them about positive outcomes of the use of this social media, because there are a lot of positive things too about learning. It can lead to community involvement, like they can be in activity with the other community members. It can be also helping them in health behavior, social emotional development, and connection with family members and communities and friends, okay? So as a pediatrician, we need to support the family to try to direct them towards the positive way of using social media, and also not to underestimate the importance of safety. So I know we as parents and caregiver, we are getting curious and we might not be happy with what we see. We better have a conversation. We know teenagers and others, even younger kids, instead of talking to each other, they can be sitting beside each other and texting each other the same information that they could have opened their mouth and shared or turned around and talked to them. We can see not only about teenagers, we see it also within the family. How many times you are in the restaurant and each one in their device, or in the mall and each one in their device, or even at the table, dinner table, and each one on their device. And also how many times a parent or a caregiver talking to a teenager who is annoyed and don't want to talk to you and ignores you. And all of these you can feel the heat, like it's not always pleasant, but we have to work around it. And I hope we end up having this viewing together, getting engaged with your kids, and also have fun together. You can watch something very educational together, or fun and entertaining and positive. It can be related to having a selfie or sharing a picture with their dad or with their family. It can be as they cook together, work together, and the whole family can be having some fun together. So there are many positive ways of using this social media, and we can actually use it to have a recipe together and work as a one team and use it. So it's not always negative, and these are some resources. The one I want to highlight is the American Academy website, American Academy of Pediatrics, but the healthychildren.org is one word, healthychildren.org. Most of this material is from it, and there are some few papers there. I didn't put them all, but this healthychildren.org even talked about other elements that my 45 minutes or 50 minutes now is not enough. Thank you all very much and appreciate your attention. And I hope you find some of what I said helpful, and hopefully across the spectrum from a little infant all the way to our seniors, we can figure out how to use social media safely. Thank you.
Thank you so much, Dr. Khidir. Such a wonderful conversation. And as I heard you speak, I'm thinking some of this conversation is so scary, but you said it so nicely. It's important to have these conversations. It's important to, have that awareness, because only when you know can you put some of these, guardrails or boundaries in place. I wanted to start by thanking you. There are many, many comments saying, thank you, Dr. Khidir, for fantastic sessions. I'll start with a question. I think it's the hardest of the questions, so I will get done first. I think it might be a parent, and the parent is asking, what is the right age to give a phone to the child? Because I think that is a question that a lot of people are asking in different ways. So if you can shed some light on that.
Great. Thank you for a simple question with complicated answer. So let me try to simplify it. So the first question is, why am I giving a phone to a child? So let's start there. Okay. Now, if I'm giving the phone to the child to be able to communicate, let's say in trouble or somewhere else, and I want to give them a phone so they want to contact me or call me. I know there's the Nokia, the 50 reals one, you can give them that, but they will be teased to death. They will laugh at them. So that's the problem. Now, if you're giving it to them so they can entertain themselves, actually, are you okay that they will press something? The little fingers can press whatever and they get whatever. So that's another problem you have to be aware of. I don't think we should give them the phone and let them grow with the phone. They can watch in the phone. The last two pictures I like with the parent is holding the phone or the child holding the phone, and we're viewing it together, because otherwise, if you leave the phone in their hand, especially smartphones. So if you're talking about regular Nokia phone, give it to them whenever they can figure out the numbers and they memorize your number so they can call you. But all these smartphones can be a little bit tricky to give it to them. So maybe when they're teenagers, but after you prepare them to how to use it and have all the guards clearly explained to them. Otherwise, things can get out of control.
Yeah.
Now, if you don't give it to a younger kid nowadays, I can see 5, 6, 7, 8 years old walking around with their phone, and they are so proud they have a phone. So prepare them for peer pressure if you're not giving it them too early. And if you give it to them, it's a very hard, tough way to balance that. So my humble answer will be, after they fully understand the safety measures, you have the parental control. And that parental control, you have to revise it every now and then, because they will figure out something else, or someone else will help them to figure out something else.
Excellent.
I know I can give a straightforward answer, but I would prefer not to give it to anyone before they become fully aware about what's going on.
I love that. I absolutely love that. Thank you so much. And the next question is kind of a follow-up to that question. So the child already has the phone, or and the child is showing some problematic signs of using the device. I think this is a parent who's asking, what is, a good strategy to manage this? Do you recommend a total ban? Because she says it leads to anger and depression. And I also heard that a lot of the social connections for young adults, especially, is online these days. So yes, your take on whether a total ban is the way to manage it, or if there are other options.
So again, how old is that child? So and also it depends on what they're seeing. And nowadays, it's not only the phone. Even if they want a cookie or a candy or something in the mall, they have a tantrum with that. So the same thing will happen with the phone anyways. So it depends on the age of the child, and it depends what are they seeing and how they're using it. The simplest way is not total ban, maybe, because if they are refusing, because that's where the resistance comes, they are refusing to let go. Are they really almost in the addiction situation that you need some psychological kind therapy? Unlikely. So then what we can do is try to take them back to, okay, I'm not taking it away from you, but let's set some rules. Depending again on the age. Is he 17 years old or she's 17 years old, or they are 11 years old or even 7 years old? So you have to set again the boundaries. You have to limit the time. You can maybe take it from them and give it to them in a certain time. So for example, if they take it to school, they take it to the park or the playground or wherever they're going, then maybe you stop that because you're not supervising them. You can have it with them at home, but not hiding in the room. So try to start slowly to bring them back to baseline because they already have used it and so whatever. And then as you're doing this, build relationship with them so they can disclose to you what is going on. Maybe someone is bullying them and you don't know. Maybe someone is telling them to do some bad stuff they don't believe in, or they already started some bad stuff and that you don't know about. So you as a parent, maybe first of all, build some relationship with them. That's why, remember earlier I said, no threatening, don't take it away from them, especially when you discover the cyberbully command, where you need to report. So depending on the age, you can start with them. First of all, try to build some bridges. Try to, instead of having it 8 hours a day, they go wherever they want with it. Try to narrow it slowly until you reach baseline. And then from there, sprint again. And meanwhile, you try to figure out what is going on, why their behavior is changing. I hope that answered the question.
Absolutely. You gave some very, very useful tips, and which kind of leads to my next questions. You said, build bridges, and then, give them a boundary, and then slowly narrow it down and keep that door open. So this next question is, what could be some effective strategies for setting boundaries without being too intrusive? So, there is that fine line between sitting outside and being in the teenagers. I think this person is talking about young adults and teenagers. So, can you elaborate or maybe just summarize for us, Dr. Khidir?
Yeah, teenagers is hard to handle because they have been doing this for a while and became their right. The minute you take the phone, you are violating their space and right. So I think the best way will be is to become a friend with them first. Let them talk to you about what is bothering them. Because they usually say, if you don't find love at home, you look for it outside. So what happened is maybe they're highly connected with a virtual person there who is giving them advice. And truly, there are some virtual people or whatever, AI, whatever you can call it, are really filling their heads about many things, including when your mom said this to you, or when your dad said this to you, or when the teacher asked you to do, almost to that level, they want you to rebel everything. So the first thing is to build bridges again and be a friend with them. And then slowly they will hopefully open up. It's the same thing when you handle teenagers, wherever you are. You have to, first of all, build bridges I think the main thing for many of us, we are very strict. And when they are in trouble, they feel like, oh my God, if I open my mouth, I'm getting in trouble. So they avoid doing that. But when they grow up after like certain age, and before it was like around 14, 15, I think now even from 7 years old, you have to figure out a way to find a common ground with your child to be able to help them through all these difficulties. Otherwise, you will not even know about it.
Right. Thank you. Thank you so much. That was such a comprehensive answer. Dr. Khidir, I know we are almost at time, but is it okay for one more question?
No problem, please. I know it's a very complicated topic.
There are actually a lot of parents who are asking. You did say the guideline for the recommendation for screen time for 2 to 5 is, 1 hour. If parents were to go back from this talk and make one change, I know they're asking, what could we do? But I'm asking you, if parents could do only one thing today to, keep that screen time for 1 hour, what could be that one thing that they could do to manage their screen time for children 2 to 5 years?
So to limit it from 6 to 1, for example.
Yes, to bring it to 1 hour.
So if they're doing many hours, you try to chop it 1 hour at a time. Like every 2 days, decrease it by 1 hour. And you have to replace it with something that entertains them. Because they're so much into that screen, and all of a sudden you take the screen out for 1 to 2 hours. What am I going to do? They feel crippled. They don't know what to do. So be prepared to entertain them. It can be as simple as, oh, let's go and do this cake together, or let's go and garden outside. Just try to be, I know it's hard because you're working maybe, and maybe you're tired. Yes, just try to figure out some physical activity which is fun. It can be, let's watch a movie together, although it's media, but away from social media, if it makes sense. Instead of YouTube letting them, it's my phone, I have my 1 hour in the, let's say they're doing 6 hours or 4 hours, hatta, social media, watching YouTube from one clip to the other, right? If you take it away for 1 hour today for 3 days, what are you going to fill that 1 hour with? So you have to be creative in giving them another activity that is fun. It can be something you do together, and you have to try to work on something they like. And it won't be like, I'm taking the phone for 1 hour, let's do something else. Tempt them to come with you to do something as much as you can, knowing your own child. Nobody, there is no one size fits all. So you have to put the, what do you call it? The innovative hat on.
Yes.
And just be like, as the best creator, or what do you call it? Yeah, just be very, create something that the kid, it match their, you go to them versus them coming to you. I hope I explained.
No, absolutely. It's very clear. I mean, we as parents, we want a quick fix. We say, oh, 4 hours of screen time, now it's only 3 hours. But to take that effort to take 1 hour and give them something else to do. So, no, thank you so much, Dr. Khidir. There are many more questions, but we are at time. I do want to say many of our attendees are thanking you for a very for an excellent talk, and to increase their knowledge and build awareness. So thank you very much, and thank you a lot to our audience. We've had about 200 people attend this talk today, and we hope to see you for the next session in March. So thank you very much.
Thank you. Thank you all, and to all our attendees, interesting questions, and I hope you have find it helpful. Thank you.